Okay, so today we're going to talk about the development of the vascular part of the cardiovascular system. And in today's discussion, we are focusing on the development of aortic arches. So we'll be talking about their stages of formation and their adult derivatives. And also we'll be discussing some congenital embryological defects like coarctation of the aorta and other arterial system defects. So cardiovascular system, if you recall, I told you before, is the first major system to function in the embryo, and the primordial heart and vascular system, they appear in the middle of the third week of development. This early development occurs because the embryo can no longer acquire its nutrition and oxygen by diffusion alone. So blood vessel development involves two major processes. The first one is vasculogenesis, in which the mesenchymal cells are going to transform into the endothelial cells of the blood vessels and also the blood cells, whereas the sprouting or the formation of new branches from these larger vessels is known as angiogenesis, which occurs later on. And now when we talk about the aortic arches, what are the aortic arches? Remember, they're simply the arteries which are present within the pharyngeal arches. And the pharyngeal arches, they make their appearance in the fourth and fifth weeks of development. They are bars of mesodermal tissue present in the developing neck region of the embryo in the earliest stages of development. And each pharyngeal arch has its own cranial nerve and its own artery. So the arteries which are present within pharyngeal arches are called aortic arches. They're arising from the aortic sac, which is the most distal or most cranial part of the truncus arteriosus, which is the cranial part of the heart tube. These aortic arches are embedded or lying within the mesenchymal pharyngeal arches, and they themselves terminate in the right and left dorsal aortae. So here is the diagram showing the fetal circulation in the early stages, where you can see this here is the heart tube, and in the cranial most part of the heart tube, here the aortic sac is present, from which are emerging these arteries. As they're lying within the pharyngeal arches, they're called aortic arches, and they're numbered accordingly. They are terminating within this larger blood vessel, which is the dorsal aorta. Now, this is a slice which has been taken through the upper half of this is the sagittal section taken through upper half of the developing embryo. On the external aspect, we can see these pharyngeal or branchial arches, as they were previously called, are numbered with Roman numerals in a craniocaudal sequence. And from inner aspect, we can see that there is an artery which is present within each pharyngeal arch, and that artery is numbered according to the pharyngeal arch. The arteries are arising from the aortic sac, and they're terminating in the dorsal aorta, and these arteries are called aortic arches. And their appearance is craniocaudally, which means they're not all present simultaneously. And their numbering, remember, is 1 to 6. The fifth one is either very small, it will regress, or it doesn't appear at all. Now here I'm showing you the basic pattern of the aortic arches in the early stages of development. And in this basic pattern, you can see these are the aortic arches. And in a craniocaudal sequence, we are assigning them Roman numerals 1, 2, 3, 4, and 5th and 6th. You can see the fifth is not so prominent. It will regress. So it doesn't form any adult derivatives. The rest you can see they are paired and their origin is from the aortic sac, and they are terminating into these paired dorsal aortae. Now, what is the fate of aortic arches? What is going to happen to them in the further stages of development? Well, at the end of the fourth week of development, most of the first aortic arch will disappear except a small portion that persists to form the maxillary artery. Similarly, the second aortic arch also disappears while the remaining portion forms the hyoid and stapedial arteries. So now looking at that basic pattern of the aortic arches in the next stage of development, we can see that a larger portion of the first aortic arch has disappeared, except a smaller part which has remained, and this is now forming the maxillary artery. Now, while the first aortic arch is disappearing, you can see the second is still present and the third is also prominent. Now, at the beginning of the sixth week of development, the third, fourth, and sixth aortic arches, they're all prominent and large. And the aorticopulmonary septum has divided the truncus arteriosus into aorta and pulmonary trunk. So here you can see, if you look at the region of truncus arteriosus, it has been subdivided into this here ascending aorta and pulmonary trunk by the aorticopulmonary septum. Also, we can see over here from the aortic sac are emerging the third and fourth aortic arches, and the third one is the most prominent one at this stage of development. Now, what happens to the aortic sac? The aortic sac is the part of the upper part of truncus from where the aortic arches were emerging. The right and left horns, there are two horns of aortic sac, right and left. The right horn will give rise to the brachiocephalic artery, and the left horn will give rise to the proximal segment of the aortic arch. So here, if we compare the basic pattern of aortic arches with the further stages of development, let's right now focus on, we were talking about the aortic sac, its right and left horns. You can see the right horn is from the brachiocephalic artery and the left horn is from the first portion or segment of the aortic arch. Also, you can see over here that the third aortic arch has formed the common carotid and the internal carotid artery, and from here has sprouted as a branch the external carotid artery. If you look at the first and second and their major portions, they have disappeared. And also we can see the fifth one was already insignificant, so it has regressed. And now let's look at also the dorsal aorta. We can see the right dorsal aorta portion of it is obliterated, that is, it disappears, whereas the left dorsal aorta is forming the arch of the aorta. So like I said, the third aortic arch forms common carotid and the first part of internal carotid artery, whereas external carotid artery is a sprout or a branch from third aortic arch. The remainder of the internal carotid is formed by the dorsal aorta. Whereas the fourth aortic arch, it has different fates on the right and left sides. On the left side, it forms a part of the aortic arch, whereas on the right, it forms the proximal portion of right subclavian artery. Whereas the proximal parts of the sixth aortic arch, they will persist to give rise to the pulmonary arteries. So that's why sixth aortic arch is also called the pulmonary arch. And also remember, on the left side, the distal part of the sixth aortic arch also persists to form an important channel, which is the ductus arteriosus. So here, let's look at the fate of the fourth aortic arches. On the right side, you can see it is formed the right subclavian, and on the left, it is formed the arch of aorta. Whereas the sixth aortic arch, it has formed the pulmonary trunks. In addition to that, on the left side, it has also formed the ductus arteriosus. So ductus arteriosus, remember, is the channel which is connecting the pulmonary trunk with the aortic arch in fetal life. Now, eventually, this is the pattern of the blood vessels which you will have in the adult. So these are the adult derivatives, and this is the adult pattern. And we can see over here, this is the arch of the aorta. And from here emerges the brachiocephalic artery, as well as the left common carotid and left subclavian. And whereas we can see that the ductus arteriosus has now been replaced by a ligament, which is known as ligamentum arteriosum. What is the fate of the carotid duct? The carotid duct is actually that part of dorsal aorta which is between the entrance of third and fourth aortic arches, and it will be obliterated. So between third and fourth aortic arches, we are looking over here at this portion. These dotted or broken lines are representing the carotid duct, and it will disappear. So now we're going to summarize the derivatives of the aortic arches. This is a very important table. If you can memorize that, it's going to help you not just in your exams, but also in recollection whenever you're trying to go back to the topic. The most essential part of this topic will be what are the adult derivatives of the aortic arches. So you should know the first arch is going to form maxillary arteries. The second will form hyoid and stapedial arteries. The third will form common carotid and first part of internal carotid arteries. Till now, the derivatives are the same on the right and left side. But in case of fourth aortic arch, the derivatives are different from the left and right. In case of the left fourth aortic arch, it is going to form a part of arch of aorta. That is the portion between the left common carotid to left subclavian arteries. And on the right side, the fourth aortic arch will give rise to the proximal or initial portion of right subclavian artery. Similarly, in the case of the sixth aortic arch, both right and left will form the pulmonary arteries. But in addition to that, what you have to remember is that the left sixth aortic arch also forms ductus arteriosus. The distal portion of the right subclavian artery as well as the left subclavian artery, they are derived from seventh intersegmental arteries. Now we want to summarize the embryological origin of the aortic arch, because the aortic arch is a very important vessel, so you should be able to recollect the formation of aortic arch. And you can do that by simply remembering that there are the three portions of this aortic arch. The first portion has its origin from the left horn of aortic sac, and then the middle portion, that is from left common carotid to left subclavian, they are that is derived from the left fourth aortic arch, whereas the remainder of the aortic arch is derived from left dorsal aorta. So these are the three origin points of the aortic arch. These are the diagrams which have been taken from Keith Elmore's Embryology. And the thing I like about these diagrams is that they are color-coded, and so they can take you through the further development of each arch separately. So if you look at this number 3, which is colored in red, that is the third pharyngeal arch. You can, if you follow it in the further stages of development, you can see it's going to form the internal carotid artery, right, and a portion of the common carotid artery. So similarly, you can trace the fourth and the sixth arches as I had discussed before. Now, along with this topic, something that you should be familiar with is the relation of recurrent laryngeal nerves to aortic arches. Now, what happens is that because of the repositioning of the heart, that is, it's going to shift caudally, these nerves, that is the recurrent laryngeal nerves, they hook around these six aortic arches. And as they hook around, they then again ascend and go upwards to the larynx. This is why they are called recurrent laryngeal nerves, because they have a recurrent course. After the disappearance of the distal part of the sixth aortic arch, the right recurrent laryngeal nerve moves up and eventually it hooks around the right subclavian artery. Whereas on the left, the recurrent laryngeal nerve remains hooked around the ligamentum arteriosum. So here you can see that this here is the ligamentum arteriosum, and the left recurrent laryngeal nerve is hooked around the ligamentum arteriosum, whereas the right recurrent laryngeal nerve is hooked around the right subclavian artery. Now we're going to talk about some arterial system defects. Since we've discussed the normal development and formation of the arteries, the main arteries and main blood vessels, let's talk about some more common birth defects related to malformation of the arteries. The first one you should know about is coarctation of aorta. Now the word coarctation literally means a narrowing. So there is a narrowing of the aortic lumen that occurs below the origin of the left subclavian artery. And this is further of two types, can be of two types, depending on whether this coarctation or this narrowing is occurring above or below the ductus arteriosus. So here you can see coarctation of aorta. A is the preductal type, where this narrowing of the aorta has occurred before the entrance of the ductus arteriosus. So the ductus arteriosus is still patent. The B over here diagram is showing you the second type of coarctation of aorta, in which the narrowing is after the or below the entrance of ductus arteriosus. So in this case, the ductus arteriosus has been replaced by ligamentum arteriosum. Now, in the postductal type, you can see the caudal part of the body is going to be supplied by, there's going to be a collateral circulation develops, the large hypertrophied intercostal and internal thoracic arteries, they're going to supply the lower half of the body, and that also produces a characteristic notching of the ribs, which can be seen on the radiographs. And over here, you can see the upper part of the body is going to be supplied by this blood over here. The large amount of blood supply going to the upper part of the body gives rise to higher blood pressure in the upper limbs. Postductal coarctation, let's look over here, look at it again, as this narrowing of the lumen is going to cause the alternate collateral circulation development. As I mentioned, these intercostal arteries, they are going to become enlarged and then compensate for the blood being supplied to the lower half of the body. There's another congenital birth defect which can occur, that is the double aortic arch. This occurs due to the persistence of the distal portion of the right dorsal aorta. If you recall, during normal development, this part was going to be obliterated, but if it doesn't disappear and it persists, it can cause a double aortic arch. And then the symptoms or the consequences of that could be that this double aortic arch can form a ring-like, it can form a ring around these trachea and esophagus, and then cause pressure effects because of compression of the trachea and esophagus. So this concludes with the development of the arterial system, and we talked about also some birth defects. But remember, the derivatives of the aortic arches, they're very important. And that table, if you just note that down in your practical copies, and if you revise that table, then you should, that is the most important part of the development of the arterial system, that you should be able to easily recall the derivatives of the aortic arches, which have been labeled from 1 to 6. So this concludes with today's topic, and in the next lecture, I'm going to be discussing the formation of the venous system. So if you liked today's lecture and you found it helpful, don't forget to like and subscribe to my YouTube channel, AnatomyMentor, and also press the bell icon for regular notifications of the new uploads, as I will be coming back with more lecture topics on embryology, and I also have lots of lecture topics on gross anatomy, neuroanatomy, and histology. So best of luck with your studies. Take care, stay blessed.